It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Welcome everyone to the Sam Lesante Show, folks. We're on location here today at the Lehigh Valley Hospital, Hazleton, and we're going to bring you some very, very important information doing healthcare as Lehigh Valley does the best, okay? But first, let me say this. I want to thank all of you who have come up to me when you see us, my wife and I, and thank us for having this show, providing health information for you. And certainly that's why Lehigh Valley is your community partners, and we appreciate that very much. Once in a while, my email is sam@ssptv.com. Please feel free to, if you want, to give me suggestions of what you'd like maybe the hospital to cover. We're here to be a service to you. Now, being a service to you, we have two guests today. We have Terrence Purcell, who is the president of Lehigh Valley Hospital Hazleton, and also the Northwest Region. We're going to talk about that, how we bring much better care, health care to you. Terry, thanks for coming on the show again.
Thanks for having me. So,
Terry, for those people who know you,
sure.
A lot of good things to say about you. I don't know why. You must pay them off pretty good, but they do a good job. Tell me about yourself, Terry.
Well, I grew up in Monterey City, went to Monterey Area High School. After I got married, I moved to Barnesville, which is right outside of Monterey City, so I lived just across the Luzerne County line. Been working in healthcare since 1986. My first job was up at Hazleton at St. Joe's Medical Center. I started in human resources. I worked there for a few years, working with the nuns, the Bernadine nuns. They were great to work with. And after 2 years, I ended up going down to Pottsville, and I worked at Good Samaritan Hospital. I was there for 6 years. I worked with Bill Reppy when I was there, so the two of us became friends and colleagues, and we worked very close together. After that, I spent 25 years in the Lehigh market. So started out in human resources. I ended up the president of the St. Luke's Carbon Campus, and I left St. Luke's about 3 years ago to join Lehigh Valley.
What was the reason that you were attracted to Lehigh Valley?
Because
you've been in the health field for so many years.
I have great respect for Brian Nestor. He does an outstanding job leading our network. And I worked very closely with Lehigh Valley when I was in Lehigh. For example, we were the first hospital in the state of Pennsylvania to get telemedicine services, and we got those through Lehigh Valley. So they were very supportive. They provided a lot of great support for our small hospital, and they were a great partner.
So you bring back memories when you say St. Joseph's, okay? Because I worked there, worked with them many, many years, okay? You've seen transitions in healthcare, all right, and from going back to St. Joe's, etc. So, what have you seen in the last number of years, you know, in terms of advances, technology, etc.? Because sometimes you just shake your head and say you can't believe what we have today. You know?
Absolutely, technology is always improving. I remember back in the early 1990s when the first MRI came out, and I was a test patient, and now we have multiple MRIs throughout the region right now. So every year we're seeing new and better technology, and it's resulting in better patient care for our patients in the community.
Yeah. Now the interesting thing is we're talking about the Northwest Region. Now, how was this established? Okay, and so our viewers understand, what is the Northwest Region about?
So several months ago, the hospital reorganized, and we reorganized in the network. So I'm the president of the Carbon Campus, the Schuylkill Campus, and the Hazleton Campus. And the thought is, if we could work together regionally, we could improve and expand services. For example, the general surgeons in Hazleton take call for the Schuylkill campus 1 week a month. So if we work together, we're going to improve the services and the physicians available to the local communities.
So these would be considered the advantages.
That's definitely the advantage.
Okay.
Yes.
Okay. So they're sharing
staff. We're sharing resources. As you know, the hospitals are very busy right now dealing with the COVID pandemic, and our hospitals are full.
Oh my God.
Hazleton and Schuylkill work very close together. So if the ER is full in Schuylkill, we're bringing up some patients up to Hazleton, and vice versa. So our nursing departments have been working very closely together to make sure we're providing the best possible care for our patients.
Speaking of that, I'll have Dr. Lenko on. We're going to talk about COVID and this terrible thing. I just wish we had a magic wand, Terry, and just say, get rid of it. It's just incredible, you know, it's a whole different world as far as I'm concerned. We're building a new hospital, okay, in the Northwest region in Carbon. Tell me about that.
We're very excited. So it's going to be a smaller hospital. It's an 18-bed med-surg hospital, but it's a full-service hospital. So we will have a 24/7 emergency department. Our emergency department will be staffed by the same physicians that staff our Level 1 Trauma Center in Cedar Crest. So we're going to have some outstanding ER physicians available in Carbon County. We're going to have a full operating room. We're going to have complete radiology, including MRI, CAT scan. We're going to have all the outpatient services. And in addition, we're going to be bringing a lot of new physicians to Carbon County. Carbon County is underserved with the number of physicians available. So at Lehigh Valley, we're going to be bringing a lot of physicians to improve access. So a lot of patients have to leave the county and go to Allentown for their care. So our goal is to keep as much care local as possible.
Every once in a while, Tammy will get a couple doctors and we'll talk about what they're doing. And I always like to ask the doctors why they decided to come to Lehigh Valley Hospital, because you're certainly always searching for the best, you know. And you get a mixed array of comments of they like the area. Certainly it always turns out to be that they like Lehigh Valley, the network, okay. How do you go about attracting physicians? Because certainly there's areas sometimes you're overflowing in, sometimes you're short on, okay? And sometimes people think, well, they don't care about, you know, whatever. I don't think that's the case at all. How do you go about attracting them and getting them in?
Well, first of all, it's a little easier to recruit to Lehigh Valley because we're a physician-led organization. Dr. Nestor, with him being a physician, he looks at it from the patient's eyes. So we're a business, but we're also taking care of people, so that's most important. We take good care of our physicians. We're fortunate to have such dedicated, outstanding physicians. In Hazleton, we have a lot of local people like Tony Laurent, Mark Lobit, so it's nice that we have some local people that decided to come home and work. But Lehigh Valley is a great place to work. We have the best technology, we have the best people, the best colleagues to work with, and we have beautiful communities. So Hazleton's a beautiful community, a lot of nice places to live. Our schools are good, so that's how we're able to attract such talent.
And that's so important. So you're doing some development here. I came in, I see them knocking down the old nursing where my wife went to school. What are you doing that for?
Yes, it's a bittersweet decision.
Yeah.
Obviously, the School of Nursing closed a long time ago, and cancer care is so important in our area. So many people leave the area for radiation therapy because it's limited available. What's nice about our cancer center, we're affiliated with the Memorial Sloan Kettering Alliance.
Yes.
So we have some of the best trials, some of the best medications, and some of the best research available. So the residents of Hazleton and the surrounding region have access to some of the best cancer care. And it's working. So the mortality rate in the United States over the last 20 years is decreasing for cancer patients. And it's because we've done a great job taking care of these patients. So there's a lot of good things, and we're only going to improve the level of cancer care available for this generation and next generations of Hazleton residents.
Explain to us how that thing works when you're talking about working with Sloan Kettering and you know, the fact that you have access. Now, does every cancer patient or the doctors, do they confer with Sloan or only on certain cases, or how does that work?
So I'm not the expert, Dr. Mike Evans is, but it's only on certain cases.
Okay.
It's those difficult cases. So
There's a guy, Evans, fabulous.
Yeah, absolutely.
He's the best.
We're so fortunate to have him in the market.
Top shelf.
So certain cases are referred to Memorial Sloan, and they have studies going on for different cancers. So
this has been going for a little while, hasn't
for a
it?
long time. So for probably about 7 to 10 years.
Yeah.
So if they're doing a study on a certain type of cancer, we could enroll a Hazleton resident in that study.
Okay. And looking at telemarketing or telemedicine, I'm sorry. We touched about that before. Explain to the viewers what that is.
Sure. So telemedicine, we have access to all of the specialists down at Lehigh Valley Cedar Crest. So for example, we have a lot of COVID patients, and we have an infectious disease program that's down in Allentown that is absolutely incredible. So we're able to get a consult from some of the best physicians in the United States for a patient that's laying in the bed in Hazleton.
Okay.
If someone's having a stroke, they come into the ER, we could get a telemedicine consult with the neurologist in minutes. And the faster we provide the care, the better it is for the patient. So there's just so many outstanding things going on with telemedicine.
Now, you recently were awarded the Leapfrog A grade. Okay, tell me what that, because I'm thinking of a frog leaping. You know?
So Leapfrog is a quality metrics that all hospitals in the United States are rated. And at Hazleton, we're proud to say we're a Leapfrog A. So we're an A rated hospital. We have been for several years. And what that means is we provide great and outstanding quality. We look at things like our mortality rate, our length of stay, readmissions.
And you do this, or does an outside agent?
Independent organization.
All comes
they
in.
take all of our quality metrics and they come back and score us,
Yeah.
and we're an A.
Yeah.
Now you can't get better than that.
No, you can't. You know, it's funny, you mentioned about Brian Nestor, okay, and he was on my show with Fletcher, my good friend. How's John doing?
John's doing great. I talked to him yesterday. He's doing outstanding
Send our best
things.
to him. We
I
miss
will.
him, but you know, you're filling in pretty good for him. But we're talking about, you know, how it filters from the top, okay, and it comes down. And all the people that I have been familiar with, or I just recently had to go for a test at the wellness center, and all the receptionists, the nurses were just great, you know, and they're concerned about it. And it wasn't a fake concern, and I want to applaud them for that, you know, particularly with the craziness that's going on. You know, when you bring someone to the emergency center, you want that first service immediate. That's the only thing, but there could be other people that are more need your help more so, and I think that's sometimes where people get a little nervous about the emergency room, you know.
Our workers are absolutely incredible.
Yeah.
What they've done in the last 2 years, the care that they provided, the stress that they're under, they put themselves at risk, they put their families at risk, but they show up every day because they care about their patients. And we are so fortunate and blessed to have such caring colleagues in Hazleton Schuylkill and our entire network. Our doctors are here every day, and we're seeing a lot of sick patients, and it's busy and the hospital's full, but they're here every day providing outstanding care for our patients.
What do you see in the next, and I know when we talked to Dr. Lenko, we're talking about COVID-19, which is disgusting, but however, we have to live with it. What are your thoughts, you know, being in this medical field and every day seeing here and hearing the different, what do you think?
Well, COVID does scare me. We need to do everything we can to protect ourselves now and protect each other. So we're still not out of the woods yet, and we're going to be dealing with this for a long time. But I foresee great things for Hazleton. We have a lot of opportunity for growth. As you know, Coordinated Health merged with us a few years ago. We have this beautiful facility out at Station Circle that's only half full, and we have a lot of great physicians that are there taking care of local residents. So we have a lot of opportunity to expand and grow. So I see the Hazleton community, you're going to see a lot more providers in the market, a lot more services, and we're going to continue taking care to the next level.
And my friends, we talked about before I opened about, you know, input. For those of you who've been to the hospital or to the doctors, you get a survey. And on that survey, it's very important that you fill it out, because that gives them, correct me if I'm wrong, that gives them the tools to say, well, okay, we need more in this area or whatever, but I think those surveys are critical.
They're critical. So the first thing I do when I get to the office in the morning, I turn on my computer. The first thing I look at is the patient feedback. 99% of it is outstanding, and we look at that and we thank those people for doing a great job.
And you want the truth.
And then there's some times that we don't meet the patient's expectation.
Yeah.
I personally email those patients, I call patients, my team calls them, because we want everyone to be 100% satisfied. We want our patients to recommend us to their friends and family. We want them to give us the highest rating possible, because we care. And we're only as good as the care we provide, and we want to provide the best to our patients.
And that's why Lehigh Valley Hospital Network is the leader in healthcare.
Absolutely.
Okay? And when you say community partners, you mean it, okay?
I agree.
My friends, I'm talking to Terry Purcell. He is the president of the Lehigh Valley Hospital here in Hazleton, and also of the Northwest Region.
Northwest Region.
It's always a pleasure talking to you.
My pleasure.
I hope to get you back on some more, and we'll bring us up to date on what's going on in healthcare. Okay.
I'd be happy to be on.
Okay, we're gonna take a break. We come back. COVID-19. I know it's disgusting. It's like you're tired of hearing about it, but it's reality, my friends, and we got a good person coming on to tell us what's happening with COVID-19, and you've got to get your shots. We'll talk about that. I know you don't want to hear about it. We got to get the shots. We'll be back right after this. Well, welcome back to the Sam Lesante Show, folks. I'm here at the Lehigh Valley Hospital, Hazleton, the Annex building. We just talked to Terry Purcell. Now we're going to talk to the Vice Chair of the Department of Medicine, no stranger at all to us here in Northeastern Pennsylvania, Dr. Jody Lenko. Let's get rid of COVID-19, okay? I'm tired of it now, okay? Can we just get that? Terry said he has a magic wand. They can just wave and get rid of it, okay?
I would love that. I think we would all love to get rid of it, but unfortunately...
This is such a nightmare, isn't it?
We are stuck in it, but we are doing better. So I think there's hope on the horizon. I think we're just, waiting for some extra signs. Once we get through this winter, I think we will be in much better shape. But there already is some hopeful signs.
Okay, so you've always been an advocate, and we'll talk about the vaccination, et cetera, et cetera. So what are we seeing in Hazleton with patients and stuff like that?
Sure. So back in December, we had a pretty quick uptick in the rest of the country with Omicron. It took over very quickly, much to our surprise, a little bit quicker than we thought it would. In middle of December, we were about 50% of cases of COVID were Omicron versus the old one, which was Delta. Now we're at 99.5% of cases are Omicron. So this is the wave that we've seen over the past 6 weeks or so. And it was unfortunate timing with the holidays, that the Omicron and how contagious it is. With the holidays get-togethers, we saw a really significant increase in the number of our cases, both in the outpatient setting and also in the hospitals over the past month. So fortunately, we seem to have hit our peak in the hospital numbers. So it looks like over the past, maybe about 2 weeks ago, a week and a half ago, we're seeming to near the peak of our cases. So we're finally starting to see those numbers trend in the right direction.
So what are the symptoms?
So the symptoms are very similar to what they were before. So often it's fever, cough, congestion. The difference with Omicron that I'm seeing, a lot of my patients that present to me in the office, there's a lot more sore throats, a lot more congestion in your nose, a lot more headaches. So you're seeing some milder symptoms, especially if you're vaccinated. The people that are unvaccinated tend to get more severe symptoms quicker, but my vaccinated patients are almost always telling me that it's more up in the upper respiratory airway and less likely to go into the lungs, which is a good thing.
Okay, so I hate needles. I hate vaccinations, etc. But I got my 2 shots, and I'm now going to get my booster shot. Why are the shots and getting vaccinated, excuse me, so very important?
So we've seen this time in and time out that vaccination strongly reduces your chances of dying from the virus and strongly reduces the severity of disease. It's been about the same for the past 6 months. About 80%, if not more, of our patients in the hospital are unvaccinated, meaning if you haven't gotten your vaccine and you get COVID, there's a much higher chance, probably a 15-fold increase, that you are going to get hospitalized compared to somebody that is the same age that's vaccinated. So the vaccine works. It's really safe. We've given it to hundreds of millions of people across the world, and it's very safe and very effective. If you've had your 2 shots of your vaccine and have not had your booster, now is the time to get it. The booster shot is really designed to help decrease your chances of getting infected. That's what it seems to be doing. But if you've had your 2 shots, you still are some protection in terms of decreasing the severity and decreasing your chances of ending up in the hospital. So it works, helps stop the spread, it helps stop, it helps in so many different ways, but most importantly, it helps in you dying from COVID.
How often do we get tests? Now we have the rapid test that we were talking about. Tell us about this rapid test.
Yeah, so that's been pretty common over the past 2 months or so. The rapid tests have been much more available, and so the rapid test works by you taking a swab in your nose. So you take a small sample of the nose. You don't have to go up very far, and what that swab is trying to pick up is pieces of the virus that's actively spreading in your body. You put a reagent into a test tube, and then it goes onto a little strip. What happens on the strip is there's antibodies. There's a different protein that's looking for the virus. So what's happened is when the antibodies on the strip meet the virus that meets it on the strip, it lights up. It shows up like a pregnancy test would if you were pregnant. So what that's showing is that there's active virus in your body at the time. They're very good tests. So if you have symptoms at home, if you have a cold, if you have a sore throat, if you have a fever, and that test shows up positive at home, that is a true test. Believe it, it's very accurate.
So what do you do?
So at that point, if you're feeling just like you have a cold, stay home. Stay away from others. You have a positive test.
So do you have to take another test to find out if you...
No, you don't. So that's the good part. So now we do not have to go confirm it with the PCR. We have your proven test. Yeah. That's a good test. So you don't need to do anything else.
So someone goes, they have it, and they see that they are positive for COVID, okay? Do they call the doctor? Do they call the doctor?
Yeah, you can. If you are, I mean, if you're otherwise with mild symptoms at home, you can just stay home. You know, there's no reason for you to rush.
How long should you stay home?
So it depends on how long your symptoms are. Now, if you can stay home, if you are retired, if you don't have to go into work, if you can stay home for the 10 days of the quarantine time, it's still recommended that you stay home for those 10 days. If you have to get back to work, if you have to get back to school, there are some situations where you can see how you're feeling on day 5, hopefully have access to another rapid test, and if it's negative, come back to work early. That's not in every situation, and that's when you'd want to reach out to your employer, reach out to your healthcare provider to make sure, because everybody's rules are a little bit different.
Okay, so we were talking about this tunnel we're in, and we're hoping to see light at the end of the tunnel, okay? So you mentioned a little bit about that. Terry mentioned something about it. Give me some hope here, will you, please?
Yeah. So I think the biggest thing that I'm hopeful about is the fact we've had so many cases, and yes, they have been breakthrough cases. We've had lots more cases than we did last year at this time. We're at the same number of hospitalizations as we were last time, yet we've had probably 10-fold more cases in the community. So that just shows us that not nearly the number of people are getting as sick from COVID as they were a year ago, and that's because we have the vaccine, we have monoclonal antibodies, we have other tools, we're better at fighting it, we're better at treating this disease before it gets bad. Number one, with the vaccine, and the second way we have some new oral medications that we've just started using too in the past couple weeks that are useful, like almost like antibiotics.
Is this for people who have COVID?
Yeah.
Okay.
Yeah.
Are you treating them that way?
Yeah, there's a new medicine called Paxlovid.
Yeah.
That
What's
is
it called?
Paxlovid, Paxlovid, and it's a pill. So you take it right when you get your symptoms.
The difference between the flu and COVID. How do we know?
Very hard to tell the difference.
Yes.
It's almost impossible to tell the difference, and so the only way to do it is to get tested. So if you are not certain if you have flu or COVID, reach out to your healthcare provider, Express Cares, Urgent Cares. Most of them have access to the testing that is easy to differentiate between the flu and COVID.
We have the vaccinations, we have the tools, okay? So here again, what do you tell those people who have not been vaccinated or have not received their booster shot?
So the booster shot's kind of a no-brainer. You had your first 2. This is really this is really doing everything. It's not going to do anything different than your first 2 shots. It's the time to do it if you haven't had your booster shot yet. If you haven't been vaccinated, I have a conversation. Why? What are your concerns? What are your questions? Some people have legitimate questions and concerns.
What are some of the concerns that people tell you?
A lot of times people come to me and tell me that they don't trust it. It hasn't been studied. You know, my responses to that is that we've had hundreds and hundreds of millions of people across the globe who have been our effective study of this vaccine, and it is very safe. Some people are concerned about blood clots. Blood clots are actually way more common in COVID infection than they are in getting a vaccine. So there's a lot of nuances to what people are concerned about, and just have a conversation with your healthcare provider, but it's very safe, it works.
Very quickly, I talked to Terry about state-of-the-art technology, what's happening, and you're staying on top of healthcare, which you guys are the leaders in the state of Pennsylvania as far as I'm concerned. But you know, you're on top of it every day, and there's always something new coming down the pike. So you're looking at that. I know you were the strongest advocate for the vaccinations when they came out.
Yeah, the biggest thing, I think, the fact that we're so connected to Lehigh Valley. So all this, I'm not bringing this information on my own. This is from my colleagues and the people that are a lot smarter than me that are in Allentown, and my colleagues in infectious disease, and you know, all of our other support. So we have that constant communication, and that's what makes us strong. We're still a small community hospital, but we have all the support and resources that we need from our big health network.
So that's for sure. Anything in closing that you'd like to mention to the viewers?
No, I think this is, you know, the next few weeks are still going to be, so even though our numbers are going down, there is still a lot of COVID out there. So wear your masks. You know, make sure that you're wearing a mask anytime you're leaving your home. It's a really simple and effective way of preventing COVID, but also preventing common colds, preventing the flu. There's a lot of easy things that it prevents. Stay away from big, large crowds right now. I'm not going to say that that's going to be, hopefully that's not forever, but just be smart. And if you're sick, stay home.
I know it's an inconvenience, my friends, and believe me, no one likes it, but we got to do what is right, and thank God we have Lehigh Valley Hospital and people like you. You've been on top of it day one, so I appreciate that very much.
No problem.
Okay. Once again, you have any comments, my email is sam@ssptv.com. Love to hear from you. Thank you so much for those people who've been coming up and saying, Sam, we really appreciate the hospital. giving us this kind of information you heard today. That's why they're the leaders, and that's why they're your community partners. We'll see you next time.